Nowadays, lots of young people and women are having heart attacks. Shockingly, 1 out of every 5 women is now at risk of sudden heart attack. Heart diseases are actually causing more deaths than cancer and car accidents put together. Every year, heart diseases take the lives of over 17 million people around the world. It's hard to believe, but we're losing over 30 people to heart disease every minute, which is a significant cause for concern. These diseases can sneak up on you without any warning signs until it's too late. In this video, we're going to discuss 7 symptoms that could indicate a heart attack is coming about a month before. We'll also dive into why this is happening and give you some tips on preventing a heart attack. So, without further ado, let's get started. Symptom number 1, fatigue or short of breath. If you're feeling really tired or having trouble catching your breath, it could be a sign of a heart attack. Believe it or not, about 70% of women who've had a heart attack said they felt tired or had trouble breathing beforehand. This type of fatigue is not typical. It's more like the fatigue you feel when you have the flu, minus the cough, fever, or sore throat. If you experience profound muscle weakness or fatigue, particularly if it's a new occurrence within the past month, it's critical to pay attention. Also be extra cautious if you suddenly encounter breathing difficulties after activities, such as walking a short distance or climbing stairs, or if you feel an unusual level of exhaustion that doesn't match your exertion level. These signs may indicate clogged arteries, which can lead to a heart attack, even if you don't feel any chest pain. It can be perplexing to determine whether your shortness of breath or fatigue is related to your heart or other factors, such as anemia, bronchitis, or lack of physical activity. Symptom number 2, cold sweat and paleness. Another sign that could indicate a possible heart attack is experiencing sudden cold sweats and paleness. Studies have shown that around 30% of people who have had a heart attack have reported having this symptom a few days before the event. The sweat produced in this case is different from normal sweating and feels sticky and cold, and can be accompanied by a chill on the forehead or throughout the body. Additionally, the skin may turn unusually pale. This symptom can happen at any time, whether you're at rest, eating, playing, or doing your daily activities. It may come and go within a few minutes, and often happens repeatedly before a heart attack. Therefore, it's essential to take this symptom seriously, especially if it happens frequently. It could be a warning sign that your heart is in trouble, and seeking medical attention immediately could be life-saving in preventing a heart attack. Before we continue, if you have been enjoying the video so far, please hit the like button, subscribe, and don't forget to hit the bell icon so that you don't miss any more videos like this. Symptom number 3, back pain. Experiencing back pain near the left shoulder or lower neck that doesn't get better with movement or a little massage might be more than just regular muscle strain. It could be a sign of a possible heart attack or issues with the important aorta blood vessel. Unlike regular muscle soreness, this pain is different, sticks around, and doesn't go away with usual treatments. A weakened aorta might lead to ulcers or tears, causing strong pain between your shoulder blades. It's really important to understand this discomfort, as aorta issues need quick attention. If the pain feels like a sharp sensation from your chest to your back or a lasting pressure, especially if it's a new problem that regular treatments don't help, think about the chance of a serious heart or aortic condition. Always take new or unusual back pain seriously, as it might be your body telling you about a problem that needs attention. Symptom number 4, jaw pain. Jaw pain, particularly on the left side, could be also a sign of a heart problem or a possible heart attack. This is because our nerves and organs are connected in a complex way, and the brain can sometimes become confused about where pain is coming from. When we develop in the womb, our organs form with nerves that come from other parts of the body, which can cause pain in one area to indicate a more serious issue elsewhere. If you have persistent or unusual jaw pain, especially on the left side, it's important to treat it as a potential warning sign. It's not simply about where the pain is located, but recognizing that pain in one area can indicate a serious problem elsewhere. While jaw pain can have many causes, if you also have symptoms of a heart attack or risk factors, it's crucial to seek immediate medical attention from a cardiologist. Symptom number 5, digestive discomfort. Sometimes, feeling uneasy or uncomfortable in your stomach is not just a regular stomach ache. It could be a sign that something is wrong with your heart, especially if you have certain risk factors like being over 50, having diabetes, high blood pressure, excess belly fat, smoking, or regular exposure to secondhand smoke. Digestive discomfort, such as bloating after meals or discomfort while walking or being active, can actually be a symptom of a heart problem. It's important to pay attention to these symptoms, especially if you have any of the mentioned risk factors. A study found that a significant number of people who had a heart attack reported experiencing digestive symptoms like indigestion, nausea, vomiting, or abdominal pain. These symptoms can be easily mistaken for normal stomach issues, but it's crucial not to ignore them. Symptom number 6, numbness of the left hand and arm. If you're experiencing numbness in your left hand and arm, it's important to address these symptoms. Consulting a cardiologist can provide valuable insights into your heart health and determine if there's any connection between these symptoms and your heart. Numbness or tingling in the left hand and arm can be a potential sign of heart problems. The heart's left side is responsible for pumping oxygen-rich blood to the body, so left-sided symptoms are of particular concern. A cardiologist can perform tests such as an electrocardiogram, stress test, or echocardiogram to evaluate your heart's function and identify any abnormalities. They can then recommend appropriate treatment options or lifestyle changes to improve your heart health. Symptom number 7, dizziness. Dizziness can occur due to various reasons, such as dehydration, skipping meals, or standing up too quickly. However, if you experience dizziness accompanied by chest pain and shortness of breath, it could be a sign of reduced blood volume and blood pressure, which may indicate a potential heart attack. It is not uncommon for patients who experience dizziness to undergo cardiac catheterization, a diagnostic procedure that uses contrast to visualize the coronary arteries. Heart attacks can occur when the coronary arteries become blocked. This blockage can be caused by various factors such as inflammation, cholesterol buildup, and calcium deposits in the artery walls. Atherosclerosis is a condition where the arteries gradually harden and narrow over time, often leading to blockages. The problem with atherosclerosis is that it can be silent for many years with no visible symptoms until it becomes severe. Atherosclerosis is like a slowly growing plaque of cholesterol and inflammation within the artery that can obstruct blood flow, leading to heart attacks or sudden death. Heart attacks can also occur from partial artery blockages where inflamed plaque ruptures and creates a clot that suddenly blocks blood flow. How to prevent a heart attack? Preventing a heart attack involves adopting a healthy lifestyle and managing risk factors. This includes maintaining a balanced diet with a focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular physical activity, quitting smoking, and managing stress are also important. Additionally, managing other risk factors such as blood pressure, cholesterol levels, alcohol consumption, and diabetes is crucial. Regular checkups with your healthcare provider are recommended. By adopting these measures, you can significantly reduce the risk of a heart attack and maintain overall heart health. It's important to consult with your healthcare provider for personalized advice based on your specific medical history and risk factors. If you enjoyed this video, click on the next video and press the like and subscribe button below.